So we have been focusing mostly in interventions around surgical management of malignancies. So the talk I'll be giving is around essential surgical management for gynecologic cancers. And our goal really is to raise awareness that surgery is a key component of the comprehensive management of malignancies, including cervical cancer, ovarian cancer, endometrial cancer, cancer of the vulva. There is a thought that surgery is costly and often not achievable in a limited resource setting, but there certainly are ways to integrate that. So that is the goal of the paper. So the World Health Organization has put a focus when it comes to non-communicable diseases and the role that surgery can play. And they package that in what's called essential surgical package. And the thought is that some surgeries are meant for emergent procedures or urgent procedures. So simply put, people might think about interventions for appendicitis, but cancer really is a life-threatening condition, and some cancers can be cured with surgery, or in combination with chemotherapy, the outcomes are just so much better that surgery should be an integral part of it. So we want to discuss about the benefits of surgery really start at early diagnosis and helping primary care GPs understand their role in facilitating the transfer of patients in doing the initial surgical workup. So that might include a biopsy in the case of breast cancer, for example, certainly a look at the cervix and a biopsy for cervical cancer, and really pretty much every cancer initial diagnosis starts at the point of first contact with the GPs. Our main challenge has been the skill set that is present in the physicians. So it's difficult to call them exactly surgical oncologists at this point or a GYN oncologist because we think of that as a subspecialty, a fellowship level training. And our ultimate goal is to integrate the advanced training in the home countries in these settings. So we have several international organizations and academic institutions in the U.S. supporting us. Primarily, the International Gynecologic Cancer Society is behind us and is helping us to build curriculum. So we understand that we need to assist countries to train their surgeons, obstetrician gynecologists to a slightly higher level to be able to provide the care. And then we need to facilitate that process by supporting them, giving them some protected time for the training, and also giving an emphasis at how important that process is in terms of a comprehensive care. There is a lot of focus on the role of chemotherapy, not understanding that all the steps that lead up to it ultimately allow chemotherapy to be successful, or in some cases radiation therapy. So the surgeon many times comes before chemotherapy and before radiation to facilitate that process and to triage patients who are best managed with one modality or another. Well, our concluding points is that we are now implementing pilot studies to enhance the subspecialty or advanced level training. So our main talking points is that we need more stakeholders involved. We need obstetrician gynecology societies around sub-Saharan Africa to understand that we exist, to connect with us if they feel that they are ready for that upper level of training, and at the point that they are, that we are prepared to partner with them. I think you need first a critical number of obstetrician gynecologists to be able to even consider the more advanced level of training. And the physician themselves, they don't sit alone, they sit within a health system. So when I really mean ready, I don't mean the individual is ready. What I mean is that the health system, the Ministry of Health, and often it succeeds when it sits within an academic institution, so a university level program, that they begin to integrate some component of that advanced level training. And wherever there is a cancer center, either in development or existence, you really do need a specialized surgeon, so a gynecological oncologist, surgical oncologist, to be able to be part of that team.